Less than 60 years ago, approximately 10,000 infants died each year in the US alone due to one disease, and many more suffered brain damage. Then a drug was developed in the 1960s that gave us the opportunity to almost immediately end this suffering. However, many people still don't receive the treatment, and thanks to a recent shortage, that number's growing larger. That's the topic of this week's Healthcare Triage. To get straight to the point, the treatment is called RhoGAM, and it is essentially a shot of anti-Rh antibodies that prevents a disease resulting from blood incompatibility between a mother and a fetus. But we're going to need a little more detail to understand the whole picture. First, we have ABO blood groups, type O, type A, type B, and type AB. Beyond that, in almost every case, that is followed by a positive or a negative, as in, my blood type is A negative, or O positive. This notes whether you have the RhD antigen. If you do, you're positive. If you don't, you're negative. While the majority of people have the antigen, a small group do not. Depending on where you look across the globe, the prevalence of Rh negative blood has been estimated to range somewhere between 2.4 and 17%. Whether you possess this antigen affects who you may give blood to and who you may receive it from, but it can also affect the health outcomes of your children if you decide to have any. If a mother with Rh negative blood conceived a child with a father who had Rh positive blood, there's a reasonable chance the baby's blood would be Rh positive. This becomes a problem when the blood of the mother and the baby mix, which usually occurs during birth. The RhD antigen from the blood of the baby is recognized as foreign because the Rh negative mother's body has never seen this thing before, so it develops antibodies against it. This isn't usually an issue for the first Rh positive baby because in most instances, the exposure happens after the baby is developed and been born. For any subsequent Rh positive babies, however, trouble could be on the horizon. The antibodies that the mother developed against that antigen during the first birth are able to cross the placenta and attack the red blood cells of any future Rh positive fetuses, resulting in hemolytic disease of the fetus and newborn, or HDFN. Prior to the development of effective treatment, approximately 50% of HDFN cases resulted in death or in the development of brain damage. For a long while, these miscarriages, stillbirths, and newborn deaths or brain damage remained largely unexplained. It wasn't until 1941 that the cause of HDFN was discovered, and then not until the mid-1960s that researchers realized that administration of anti-Rh antibodies to Rh negative mothers shortly after giving birth would prevent the development of antibodies targeting the Rh antigen, therefore ensuring any future Rh positive children were protected. We now know this treatment is RhoGAM, and receipt of this shot once during pregnancy and once after giving birth translates to no worries about the devastating loss of future children. Unfortunately, not all fetuses, children, and parents are spared the loss. Some data suggest that around 50% of Rh negative individuals do not receive these shots during and after pregnancy. This is due to several factors that vary by country and region, including lack of blood typing, high cost, insufficient supply, and lack of physician education and optimal care. And it looks like this lack of such an effective preventable measure for a potentially serious disease is about to get worse because there's currently a big shortage of RhoGAM. According to the FDA, this is due to a shortage in the active ingredient, manufacturing issues, and plant maintenance requirements. There was also mention of increased demand, creating a pressure on supply, but further information has been difficult to find. The shortage is relatively new, and many healthcare professionals are scrambling to make sure patient needs are met. There are expensive tests to determine fetal blood type to determine actual need for the drug, and healthcare centers are stockpiling what they've got to use in the most necessary situations. When this shortage is over, it's clear that we need to work on making this very effective treatment available to everyone. For now, please be sure to talk to your healthcare provider if you are pregnant and have an Rh negative blood type. Hey, did you enjoy this episode? You might enjoy this previous episode on myths about labor and delivery. We'd appreciate it if you'd like the video down below. Subscribe to the channel. Maybe go to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Joe Sevitz and Edward Lilleholm, and of course, our Surgeon Admiral, Sam.